They are making a difference on 938 Live.
He's 74 and a pioneer of medical social work, and he's still working today. I'm talking about Mr. Peter Lee from Medical Social Services at SGH. We're taking a look at some of our healthcare pioneers on They Are Making a Difference who were honored by SGH recently in a tribute event called Rooted in Excellence.
Well, actually, it was like a fluke. I was studying as a marine engineer for a year, and then I was involved in a lot of youth voluntary work and then became interested in social work. Although social work was very new at that time, but somehow I was told that it has to do with work with people who are disadvantaged or underprivileged. And so I went for the course in social work at the University of Singapore and did the general social work course. Following that, there was this offer by Ministry of Health for a scholarship on medical social work in healthcare. So that's how I got interested, although I didn't know very much about what medical social work was. But I knew that you had to work in a hospital. So I thought it was interesting, and it was a specialization which I took on the scholarship, and then on graduation went on to work.
Do you think if there had been no such incentive like the scholarship, you would have found yourself in this career?
Well, medical social work is still social work, except that it is in a medical setting. And from the information I got, I thought it was a very challenging field. And it also serves patients who are sick, and with all their many, many problems, social as well as emotional problems. I thought it was a very interesting career for me.
Do you remember one particular moment when you thought, actually, I might not want to do this anymore?
It never occurred to me not to want to do the job, except that I think after serving about 10 years as a medical social worker, it was in 1980 thereabout, I had a break in service. I left medical social work service to go into some businesses on my own. And I think this was prompted not because I did not want to do social work, but I thought the incentive and the opportunities in the civil service was really, really very dismal. There was hardly any training or very, very sparse promotion, and in fact, there was no career path. So that prompted me to get out of the service. And my intention was to go out, make something of myself, and then come back to social work.
And you did come back to social work.
I did come back to social work.
Did things improve?
1988.
Did things improve?
Yes, I think certainly. It is definitely so much more attractive, and definitely it is way, way off from the time that I was in as a medical social worker.
Mr. Lee, you've probably been through the ups and downs of what the healthcare industry does provide. For those who are considering a career in healthcare, what would you say to them?
I'll say this: if they are thinking about prospects, career path, healthcare is a place they can take up, because the opportunities are tremendous in terms of training, in terms of advancement. And I think healthcare is quite diversified in profession and different career paths. You can be a healthcare administrator, you can be a professional, such as physiotherapists or occupational therapists or social workers. So there's a range of a kind of professions and kind of work that you can really specialize in. And I think mainly to go into healthcare, one really must have the right values, the right concern for people. But career-wise, I think it offers a lot of tremendous opportunities.
And that was 74-year-old healthcare pioneer Mr. Peter Lee from the Medical Social Services at SGH. This has been They Are Making a Difference. Thank you for tuning in. I'm Daphne Lim.
They are making a difference on 938 Live.